What are the most common symptoms of COVID? Fever, cough, shortness of breath. It's also common to have body aches. But COVID-19 is sometimes more than just a respiratory disease, or sometimes not a respiratory disease at all. It can mimic just about any illness. Sometimes it looks like a common cold. Sometimes it looks like influenza. Sometimes it looks like a stomach bug with belly pain, diarrhea, maybe some nausea, vomiting, loss of appetite. It can cause pink eye, a runny nose, loss of taste and smell. Sometimes even whole body rashes or areas of swelling and redness of the skin in just a few spots. It's also kidney damage, heart damage. This is a section of a heart of a patient who had severe COVID disease. This patient had inflamed lungs with ARDS and tiny clots in his lungs. And that made it hard for his right ventricle to pump blood to his lungs. And that's what caused his right ventricle to weaken and become dilated. So, like I mentioned, severe disease is causing blood clots to form in a lot of patients. When blood clots are found in the lungs, they're called pulmonary emboli. Some COVID patients have presented with a stroke as a result of having blood clots in their brain. COVID has also presented in other ways, sometimes with seizures, also Guillain-Barré syndrome. This makes it incredibly difficult to diagnose and even harder to treat. This disease can present in so many ways. There's never been a disease in the history of mankind that's presented in so many different ways.